15 years of fight against the silent pandemic, heart disease. 15 years of saving more than 2,700 lives. 15 years of Rotary Bangalore Indiranagar's contribution to providing financial support to the poor for heart surgeries. We at Rotary Bangalore Indiranagar are subsidizing heart surgeries for the poor, especially children, to make treatments and surgeries accessible to patients below the poverty line. Cardiac camps and awareness programs are conducted in underprivileged communities for early diagnosis and prevention.
I'm Dr. Srikanth, a medical doctor by profession. I'm associated with Rotary Bangalore Indiranagar for the past 32 years. I was the past president during the year 2020-2021. I have been taking care of heart surgeries for the past 3 years, and I involve myself in identifying these beneficiaries in all these hospitals. We have arrangement with 11 hospitals in Bangalore, and I screen patients from these hospitals to make sure that we help out the most needy and the patients from very poor backgrounds. Most of the cases where I screen come from Jayadeva Hospital and the Manipal group of hospitals. We use several criteria to look at and identify these pediatric heart surgery patients. We select all these pediatric heart surgery patients, that is children, from the BPL background, and we make sure that they are either urban poor or the rural poor. We also counsel the parents to take good care of the children post-operatively and also counsel them to maintain their health. Between the government grant and the help from Rotary Indiranagar, we are able to cover the surgery costs. And the money is paid directly to the hospitals. So RBI and Needy Heart Foundation have been doing yeoman service in this area and hope that we'll continue to do this for a long time to come. Thank you.
From 2007, Rotary Bangalore Indiranagar has established a string of successful partnerships with organizations like Needy Heart Foundation and with renowned hospitals across Bangalore and Karnataka. These hospitals have helped Rotary Bangalore Indiranagar expand its scope to provide cardiac surgeries at a subsidized cost. The Jayadeva Institute of Cardiovascular Sciences, under the leadership of Dr. Manjunath, over the last about 15 years, has emerged as one of the world-class cardiac hospitals in Bangalore. Now, 60% of our patients are treated at Jayadeva Hospital. Hospitals have provided a lower rate for surgeries sponsored by us. Expensive procedures like cath lab and open heart surgeries are made accessible at low cost. Expensive heart care not only puts a patient's life at risk, it also creates a huge problem for the caregivers.
Needy Heart Foundation is a group of like-minded professionals, doctors, engineers, chartered accountants, industrialists, etc., who believed that heart surgery is the need of the day. Let me tell you how it started. It was 1998 that I got a heart attack and it cost me about 4 lakhs of rupees. This is about 24 years back. I thought I could pay, I could afford that money. How about 90% of population who cannot afford, and this being the number 1 killer in the world, how do they meet their expenses? This idea troubled me. I decided that if at all the opportunity comes, I will do something in this field. In 2001, and met 3 wonderful medical practitioners, cardiac surgeons in Manipal Hospital, told the doctors, yes, let us start the movement, what we named as Needy Heart Foundation. For the last 20 years, we have done about 10,980 surgeries Though initially we were supporting almost full money required to the hospital for the patient, but in the first 2 years we did hardly, not even 100 cases, and we thought this is too slow a process. So we worked out a model. We said we will support only 30,000. Later on we increased it to 35,000 per patient. And we had tie-up with various NGOs. They said if you are giving the first 30,000, we'll give the balance. So this way we could cover many more patients than what we had. In 2007, Rotary Bangalore Indiranagar joined hands with Needy Heart Foundation. I was all along a Rotarian, a member of the RBI, but in 2007 they joined hands and we had the first global grant where 24 patients were done. And the world went around the Rotary world, and gradually other Rotary clubs came forward. They started supporting the patients, and through Rotary International, the patients started coming from 12 other countries, not only Pakistan, Bangladesh, Sri Lanka, but later on Indonesia was added, which gave the maximum number of patients to us. Patients came from Turkey, Iraq, Lebanon, and the Middle East countries. In this journey, Needy Heart Foundation and Rotary Bangalore Indiranagar, apart from heart surgery, have put up 2 other projects like Homograph Bank, which we established in 2009 in Manipal Hospital. But the second project which is set up was Cardiac Rehabilitation Center, which was more ambitious. It was total about 5 crore project, where we put in only about 2 crore. The balance was put by the government and the Jayadeva Hospital. And Cardiac Rehabilitation Center idea came to us from Japan. At that time, first Cardiac Rehabilitation Center was there. I talked to Dr. Manjunath, why can't we set up? Then number of surgeries required will be less to the poor. He readily agreed and we started working on that. We raised funds for about 2 crores from the Rotary, where I contributed almost about 1 crore, but the other Rotarians came forward. This was the first in India at that time. Thank you.
Rotary Bangalore Indiranagar is striving to provide relief with its contributions. Rotary Bangalore Indiranagar contributes rupees 35,000 per patient, with the balance funded through various government schemes like the Ayushman Bharat and other contributions. We have raised funds for these surgeries through contribution from members, donor events, crowdfunding and CSR funds. Our initiative has become a ray of hope for needy people from all over the world, so much so that patients are referred from across the world through other Rotary clubs. Rotarians of Rotary Bangalore Indiranagar are involved in screening the patients, providing logistics and emotional support for patients and dependents. Rotary Bangalore Indiranagar and Needy Heart Foundation have also set up a homograph bank at Manipal Hospital to store natural valves taken from brain-dead patients, and a cardiac rehabilitation center at Jayadeva Hospital, which imparts training and education to patients on lifestyle and behavioral changes post-surgery. Rotary Bangalore Indiranagar's holistic approach is to ensure that patients lead a healthy life after surgery. 15 years of trust, 15 years of touching lives. You can support this cause and be a part of Rotary Bangalore Indiranagar's effort.